Hello, I am Dr. Placid Sebastian, Consultant Interventional Cardiologist, Saharna Hridayalaya, Pariyara Medical College, Kannur. I would like to share some of the problems related to heart and heart diseases. I just want to share with common people why a heart is so important for human life and what are the diseases which affect the heart. Heart is the most hardworking muscle in our body which start pumping from 6 weeks of conception till the end of our last breath. Heart pumps blood and nutrients and oxygen to all parts of our body, and it also pumps blood and nutrients to its own muscles. The blood supply to the heart is through blood vessels called coronary arteries. Coronary arteries are very important because it supplies the nutrients to the heart. Any blocks in the coronary arteries produces heart attack and heart related problems. How a coronary artery disease is developed? We all know that when there is excess consumption of cholesterol or the patient is having other diseases like obesity, diabetes, hypertension, which leads to accumulation of cholesterol in the coronary arteries. These accumulated cholesterols in the coronary arteries are called atherosclerotic plaques. These plaques grow over a period of time and it can cause obstructions to the blood supply to the heart. There are plaques which 50% blocks with 70% block. Sometimes it causes total obstruction to the coronary arteries, which may lead to heart attack. So how will we recognize this problem? Usually patients will not have any symptoms till they develop major blocks. So patients with 50%, 40% blocks usually are asymptomatic. They don't have any symptoms while they perform their activities. But the blocks increases to 70%. They may feel chest discomfort while doing heavy work or doing physical activities like playing. They may feel some constricting type of pain at the center of the chest, which may radiate to the lower part of the jaw or the left hand. As the blocks increases, they feel pain or symptoms even with little work, that is taking bath or washing the car. If the block is complete or 100%, they develop major heart attack, which they feel as severe constricting type of pain associated with sweating. Sometimes some patients feel nauseating. So we have wide spectrum of diseases or problems related to various stages of blocks in the coronary arteries. So how will we go about these kind of problems? If a patient develops pain while doing exercise, he doesn't have to rush to the hospital. Only thing he needs to take rest. Then subsequently he should take an appointment with the doctor. The doctor may ask him to undergo various tests like stress test, echocardiography, and these tests show some evidence of blocks in the heart. He may suggest a coronary angiogram, and if the coronary angiogram shows blocks, he has to undergo angioplasty or bypass surgery, or if the blocks are not very significant, he may prescribe you medications. If the patient develops severe chest pain associated with sweating like heart attack, the patient should be rushed to the hospital emergency room where an emergency ECG will be taken. Once the ECG is taken and the disease of acute myocardial infarction or heart attack is confirmed, the patient should either undergo a pharmacological therapy to open up these blocked vessels or should undergo angioplasty. There are drugs which are capable of opening up these blocks called thrombolytic drugs, which can be administered through the veins of our body. Or the patient, if there is a facility available, they can undergo angioplasty. Primary angioplasty is found to be more superior than medical therapy because it long-term benefits and immediate results are much better with angioplasty. So these are the basic concept regarding chest pain and its management. But what leads to this kind of a problem? Why do somebody get heart disease or heart attack? So there are various factors which are called modifiable factors or non-modifiable factors. Modifiable factors are like high cholesterol, which we can always control, smoking, which we can stop, diabetes and hypertension, obesity, all these things we can control. But there are unmodifiable factors like age. Any male above the age of 45 years are always prone to develop coronary artery disease. Females have the protection till the age of 55 years from coronary artery disease. But there are certain familial predisposition. Some families have coronary artery disease at very young age, and gender, as I have told, male patients are always at higher risk of having heart disease. So we cannot change these unmodifiable factors. So what we can do is to change the modifiable factors like high cholesterol. So we talk too much about cholesterol, saying it's such a bad molecule. But cholesterol is absolutely required for the development of our nervous tissues. But only problem comes when cholesterol is consumed more than what we require. Cholesterols are synthesized in our body, and it's also supplied from the food what we eat. 65% of the cholesterol in our body are synthesized in our body, and 35% is supplied from the outside source. So we don't have any control over the cholesterol that is synthesized in our body, but on the other hand, we can control the amount of cholesterol what we consume. So what are the cholesterol rich food? All the non-vegetarian food items essentially contains high cholesterol, like meat, especially red meats like pork, beef and mutton. And like cholesterol rich oils, oil products, the biscuit, the junk foods, especially now, the fried chickens, fried potatoes, all this contains high saturated cholesterol, which we consume can get deposited in our blood vessels and causes blocks and coronary artery disease. So we have to limit the content of cholesterol in our body. I feel that we should encourage our children, or all of us should encourage to eat more vegetables, including green leafy vegetables and fruits. So vegetables and fruits should constitute about half of our food intake, whereas the non-vegetarian food should be less than half, 50% of our food. So in non-vegetarian food, when we talk, fish is good for our health. So especially when we prepare food, the fish curries are much better than fried fish, because fried fish definitely increases the cholesterol. And among the meat products, the chicken is the best for low cholesterol. It contains low cholesterol. Again, chicken, when you fry chicken, it increases the cholesterol level. So it is the children we should take more of chicken curry rather than fried chicken. And the cholesterol is well under control, then we should look into other aspects, like whether this particular person is diabetic or hypertensive. If the patient is diabetes, he should control his blood sugar at the optimum level. And if the patient is high blood pressure, he should control his blood pressure, because all these risk factors added together increases the chance of developing heart diseases. So these risk factors, when they are present more than 1 in 1 person, the chance of having heart diseases is multiplicative, not additive. So small amounts of slight increase in these risk factors are more dangerous than high levels of one risk factor in a patient. So once we control these risk factors, I think we can lead a much healthy life. So how do we prevent these heart attacks or heart diseases? So one, I have already told you to control the risk factors like high cholesterol, control the diabetes, control the hypertension, and somebody who is smoking should quit smoking, because smoking increases the incidence of heart diseases. Not only smoking causes cancer, it also increases heart diseases. Then patient not doing physical activity is also considered as one of the risk factors for developing heart disease. So everybody should be encouraged to do at least 25 minutes of vigorous physical activities in most of the days in a week. So when I tell vigorous physical activity, it should be brisk walking or slow jogging or some kind of sports like swimming, shuttle, basketball. Should be every day the person should do it for at least 30 to 45 minutes, at least 5 days in a week. So the vigorous physical activity means the patient's heart rate should increase more than 120 per minute while doing exercise. So very leisurely walking for 15 to 20 minutes is not sufficient or not good for the heart. So physical activity is very important, and now lack of physical activity causes increased obesity, and lack of physical activity and obesity both together can increase the incidence of coronary artery disease. Other than physical activity, now we all live in an era of stress. A lot of people have a lot of stress in terms of their stress at a working place, stress at home. So it is very important that we should reduce the stress levels. So how do we reduce the stress level? By engaging into physical activity. Physical activity is one of the most important stress busters. So physical activity reduces stress level. Then meditation, prayers, and getting in company with other people, like going for socialization, various club activities, social activities, all these things will reduce the stress in a person. So stress also will lead to coronary artery disease. So when a person has more than one of these risk factors, his chance of having heart disease is going to be very high. So it is very important that somebody who is not having coronary artery disease or heart disease should take care of all these risk factors, or somebody who has already developed a heart disease or undergoing treatment should also take necessary measures to reduce these risk factors, so that if a person who had a heart attack once, the chance of him having another heart attack is almost 5 times more than a common population. So it is very important that if somebody develop heart attack, he should be extremely careful with his diet, food, and his drug medication intake, because most of them neglect. Once they develop heart attack, after 1 or 2 years, they will stop taking medicine and they will go back to their old way of living. That is very detrimental, because I already mentioned that the chance of having another heart attack is very high in a person who has already developed heart attack. So on the other extreme is somebody who developed a heart attack should not feel that his life is doomed, and there is nothing more can be done or productive life from his disease because of his diseases. So once somebody develops heart attack or heart diseases, he should either take continuous medication, he should undergo coronary angiogram or angioplasty, or he may require bypass surgery. After an angioplasty or bypass, after continuation of medication, the important thing is, as I have told early, that particular person should continue all the medications as long as the doctor prescribes him to take the medication. He shouldn't take his own judgment saying that, okay, I am feeling well, now it's time for me to stop medication, because doctors are unnecessarily prescribing medicines. It is a very wrong concept, because most of the time we give medicines not only to prevent an attack, it also prevents further development of blocks in the heart. So it is a treatment for the attack he had and to prevent a further attack. So it is, if he neglects these medications, he may get a second attack or a third attack. So taking medicines are extremely important. Second thing, the physical activity. The physical activity after heart attack should be according to what doctor has prescribed. So what we usually suggest is staged physical activity. Initially, a person can walk half a kilometer leisurely. Slowly he has to build up based upon his cardiac function. Some patients after heart attack will have significant reduction in heart pumping. So such patients should be very careful in developing a physical activity, because that may cause significant symptoms for these patients. So gradual physical activity as prescribed by the doctor is very important. And second thing is the avoiding smoking, quitting smoking, then avoiding overweight, control. If somebody is diabetic and hypertension, he has to control his diabetes and hypertension with medications. So a person who develop heart attack should be more careful than a person who has not developed heart attack. So it is not that once you develop heart attack, he should confine himself to sedentary life, nothing like that. If the physical activity or the doctor's prescription says that you can jog for 5 kilometers, you can easily do that. So before doing such physical activity, you should always consult a doctor and get the opinion of the doctor how much the extent of the physical activity one can perform. So I have just described you about the coronary artery disease, mainly caused by cholesterol deposits in the heart. But there are many other diseases which can affect the heart, like rheumatic heart diseases. Previously, rheumatic heart diseases were very common in India, but the incidence of rheumatic heart disease, especially in Kerala, is reducing. So rheumatic heart disease are infections which affect the heart, which can damage the valves of the heart, which can cause obstruction to the valvular or valvular flow of blood. So there are treatment for rheumatic heart disease now, and there are other diseases like cardiomyopathy, the diseases which affect the functioning of the heart muscles, and these diseases will make the cardiac pumping weak. So such patient feel exertional breathlessness, or he may even develop swelling of the legs. So these symptoms are extremely important, and the one should seek the doctor's attention. If a person develop undue fatigue, patient feel swelling of the legs, breathlessness on exercise, chest pain on exercise, developing giddiness or syncope during exercise, these symptoms are probably caused by a hidden cardiac illness. So patients who feel any of these symptoms should seek the doctor's help and should be evaluated properly for any cardiac related illness. To conclude, heart is a vital organ in human body which may undergo various diseases process based on various injury to the heart or insult to the heart. So it is very essential for us to keep the well-being of our heart and look after our heart. Wish you all a healthy heart. Thank you.